Hello everyone, my name is Tom Wenzl, and my wife Carol and I are parents of 7 children, the last 2 being adopted sons. We're not therapists or counselors, at least in the clinical sense, so that's a disclaimer. Imagine an iceberg. You've got quite a bit of stuff going on beneath the surface. That's where the clinical therapists and counselors do their work. But that stuff floating on the top, well, that's kind of the parents' realm. So parents end up doing a lot of therapy and counseling on that area that's floating on the surface, along with a lot of other things. So in that regard, my wife Carol and I do the therapy and the counseling in that realm as parents. But we had some behaviors that caught our attention, and they were quite difficult at times, quite scary sometimes. So we had kind of some concerns about what's going on. And as we applied traditional parenting, those strategies didn't seem to work very well. So we decided to educate ourselves on what's going on, how these behaviors came to be. And what we found was that there's quite a bit of correlation between the trauma a child experiences and the brain development. So this presentation is geared toward bringing that information here before you, the trauma and its effect on the brain. So as you parent and you experience these behaviors, you might ask, where are these behaviors coming from? Well, I want to give you 3 cardinal rules of parenting children from hard places, which is a fancy term for early childhood trauma. Number 1, there's a trauma history. Number 2, that trauma history drives current behavior. And number 3, you need to repeat rules 1 and 2 to yourself on a daily basis. So I want to give a shout out to some of the sources that we have studied extensively to help us understand. First of all, the Karen Purvis Institute of Childhood Development. There's her website. Dr. Karen Purvis and Dr. David Cross, they were clinical psychologists who developed a system based on 50 years of observation. This system is called Trust-Based Relational Intervention, or TBRI. Give a shout out to Mike Berry, who, with his wife, put on an online class called Trauma Knowledge Masterclass. Great content, helped us understand quite a bit about how the trauma affects the brain development and how to deal with the child and along with the rest of the world, seeing what's going on and being able to communicate your child's needs effectively. I learned a lot from Heather Forbes, and I have a slide in here from the 730 campaign. Excellent slide on ACEs, and we'll get into more of that pretty soon. Let's take a look at the brain. The brain stem is basically the first part of the brain development on top of the spinal column. It's where the nerves go down the spinal cord. So that's the part that develops first when the child's in the womb. The brain stem is kind of the basement or survival brain. So instinctive behaviors develop within the brain stem. And as you work out into the midbrain and then further out into the cortex areas, you have the outer brain, the midbrain, and the brain stem. There's this little thing here called an amygdala. You see that on each side. That's been called the fear center. So as you might imagine, these middle areas of the brain are where emotions develop. So you have instinctive development here at the brainstem, you have emotions developing in the midbrain area, and then you have these cognitive areas. This is the prefrontal cortex, these outer areas of the brain. So you have logic, artistic expression, cognitive skills, rational thinking. This all happens in the outer brain. And let me tell you, there is a very long process for all these connections to be made throughout the brain, these synapses that connect the brainstem to all areas of the brain. And we're going to talk about that nurturing cycle. When there's a nurturing cycle, you have a synapse that basically wires the brain electrically to all parts from the brainstem out through the emotions into these outer areas. And like I said, this takes a long time. The child's brain really doesn't mature, neuroscience tells us, until the child's about 25 years old. You might think, well, most parents who have raised children through those years, that makes sense. They can tell just from having conversations with them that their logic sensors kind of develop and they settle down and they become, pretty clear thinking adults about the age of 25. But let's talk about that cycle of nurture. So a child needs a cycle of nurture in order to develop appropriately. So in the nurturing cycle, there's a bond that develops between the child and the caregiver, and that's usually mom. But it takes many, many cycles of nurture for proper brain wiring and development. So in this nurturing cycle, there are synapses or electrical connections in the brain. They're stimulated, and when they continue to be stimulated, they kind of grow and stretch out, and they make connections throughout the brainstem, the midbrain, and out even into the cortex. So what is this cycle? So there's a natural alarm that goes off: hunger, diaper care, etc. They're met with nurture. So a child is hungry, a child has a messy diaper, they cry, there's an alarm, something's wrong. The caregiver goes to them, figures out what's going on. Maybe the diaper is not messy, maybe they're hungry, so they're fed, and the child receives care. And this happens over and over and over and over and over again, thousands of times. So when the natural alarm goes off, the child learns, okay, I'm hungry, my diaper needs changing. This nurture that their alarm is met with helps them understand the natural world and what to do when these alarms go off. But let's say the cycle is disrupted. So what happens when the cycle of nurture is disrupted? Well, brain development is interrupted. You may not have certain synapses stimulated to grow and stretch and connect electrically to parts of the brain like they're supposed to. So brain development is interrupted. Synapses in the brain are not connected properly. In a training years ago, I was hearing about a nurse who studied brain development through every phase of a pregnancy. And what she found was pretty interesting. She was able to get very granular, and she could tell by exactly what was going on with the brain development when a mother had some kind of trauma or stress or something that maybe they weren't supposed to have, alcohol or drugs. She could tell on what day they encountered that kind of trauma because of the way it affected the outcome of the brain development. So the brainstem overdevelops. This is where instinctive behaviors happen. So instinctive behaviors are more prominent because of this disrupted cycle. the cortex functions, the outer part of the brain, underdeveloped, or there's a weak electrical connection in the cortex functions. So when natural alarms go off, hunger or physical needs, they're not met with, okay, I get this. Instead, they're met with confusion. Hunger can go off, and the child knows there's something wrong, but they haven't had enough cycles, or the cycles have been disrupted often enough that when these natural alarms go off, they don't understand. So they may be hungry, but all they're doing is crying because they can't articulate, they can't express what's going on. Even later in life, when they're able to have conversation, these natural alarms can be so confusing that they don't really understand what's going on. They know that there's something wrong, but they can't explain it. That kind of sounds scary, but this is how the child is trying to deal with what they don't understand when these natural alarms go off. So what are some of the risk factors of trauma? Well, the highest risk is going to be a difficult pregnancy. So there could be a lot of stress during the pregnancy, maybe drugs and alcohol, maybe arguments between the mother and a significant other children, other people in her life, family members. Maybe there's a really tense home life during this pregnancy. This could be the highest risk for trauma and brain development. Second highest risk is a difficult birth. Now, I know that a couple of my children, they had forceps delivery, and I was pretty shocked when I saw that. That's a difficult birth. And there could be a lot of other things going on with a difficult birth. Early hospitalization is another one where maybe there's something happening where the child is sick when they're born and maybe they need some kind of help and they have to be put in the hospital. Maybe they're put on a respirator early on. So there could be abuse. That's another risk factor. Physical or sexual abuse when they're very young. There could be neglect. Maybe there's an orphanage and there's not enough caregivers to make the rounds. Maybe they're not volunteers. So the caregivers are not able to provide adequate care. And so the nurture cycle gets disrupted from that lack of adequate care. Maybe there's trauma from surgery or natural disasters. Perhaps there's chronic trauma. Maybe there's insecurity with food and housing. So the food is not necessarily readily available all the time. So getting the family fed is difficult. And so the child often goes hungry, and this learned behavior is that there's not enough food. Maybe there's a problem with housing. Maybe they're homeless. Maybe there's other factors where they're changing homes on a regular basis. Malnourishment can lead to hoarding food or sneaking or stealing food. Perhaps there's multiple caregivers. This could be a situation in an orphanage or maybe in foster care where the child moves from home to home. You have maybe a different style. One caregiver takes care of the needs of the child in a certain way, and the child starts to get used to that, and then there's a different caregiver that's brought in. And they approach it slightly differently, and it's confusing because it's not the same as what the child's experiencing before. And this multiple caregivers can be traumatic to the child because they've got to readjust every time there's a new caregiver. Other factors can be an unresolved trauma in the caregiver. Perhaps a caregiver has not really dealt with the trauma from their childhood, and they have children, and so the behaviors of the child can trigger unresolved experiences by the caregiver. So this can create stress and sometimes an impossible conflict in that the caregiver and the child feed off each other's fear. The caregiver's response to anger is simply driven by the child's behavior or talk. And so the caregiver must confront and control their own fears in order to be effective in parenting. You can't let the child trigger you. You can't let the child drive you into excitement and escalation, because you really can't have an effective relationship when there's escalation of one or both parties. Let's talk about complex developmental trauma. So there could be an experience of multiple, chronic, prolonged, developmentally adverse trauma. I'll talk shortly here about the Adverse Child Experiences Study, the ACEs. The adverse health and risk of a person goes up with an increase in the number of ACEs experienced. There's stress that's causing health problems within the child. And so the machinery and the cells of your body are degraded by stress. We know this, but it's exacerbated with these adverse child experiences. So there's a questionnaire out there called the Adverse Childhood Experiences Questionnaire, and these are the areas that are in the questionnaire. The actual questions are oftentimes way more explicit than what I'm talking about here. But these are the general areas: verbal abuse, physical abuse, sexual abuse, emotional support, whether the physical needs have been met, whether there's been divorce or separation of the caregivers have been abused or not, household member was an alcoholic or a drug user, a household member had mental issues, and a household member incarcerated in prison. So every yes answer to any of these questions, there's only 10 questions, any yes answer equals 1 ACEs score. So probably the magic number in the next slide is about 4 or more. So if in the child's early experiences there was at least 4 of these ACEs, then that's a pretty serious and traumatic childhood. So this is a handy little graph from the 730 campaign, and it says if there are 4 or more ACEs, the person is 3 times more likely to have lung disease and end up a smoking adult, 11 times more likely to use intravenous drugs, 14 times more likely to attempt suicide, 4 times more likely to have begun intercourse by the age of 15, 4.5 times more likely to develop depression, and twice as likely to develop liver disease. At least 67% of the population has at least 1 ACE, and 1/8 of the population has more than 4 ACEs. People with 6+ ACEs can die 20 years earlier than those who have none. And the big things that are going on: abuse, neglect, household challenges. It's a very serious area of study with negative lasting effects on health and well-being. So the consequences of the deprivation of those nurturing needs, child ends up defaulting to fight, flight, or freeze. You may have heard that expression before. There's disturbed relationships and there's disturbed behaviors. So the continuum of fear in the brainstem, you see the highest level, terror. This is the place where terror lives, in the brainstem, in those those instinctive, animalistic areas of the brain that develop first. Fear and alarm and vigilance are going to be in the midbrain. Very emotion-rich areas in the midbrain. And once you get out into the cortex, that's where you would see calm. And guess where the logical conversations are going to be? Guess where the educational areas are going to be? You got to be in these calm areas of the brain and the calm relational issues in order to grow intellectually, relationally. So there's two primary emotions. This is going to be the last thing I talk about here. Love and fear. Two primary emotions. All feelings and behaviors derive from love and fear. So the love-based feelings, you can express happiness, joy, gladness, excitement, pride, and confidence. These are all derived from love. Love-based behaviors. Someone can smile or have conscious acts, empathy, reciprocity towards others, obedience, motivation, compliance, and helpfulness. But the other side of that, this is the positive side. This is the calm, the cortex areas of emotions, pretty far beyond the raw emotions. But then we have the fear-based. These are way down here deep in the emotional part, the brainstem part. But these are fear-based feelings: angry, hostility, shame, frustrated, envious, jealousness, frightened. Fear-based behaviors: lies, stealing, hoarding, gorging, aggressive, defiant, argumentative, screaming. So two areas of the brain. These are toward the center, where that's where a child may live oftentimes, who's had trauma, manifesting behaviors, manifesting feelings that are derived from these areas that's as far as they got. The brainstem, the midbrain, all these emotion centers where everything is crazy developed. And possibly the objective is to get them into the cortex part of the brain, the calm areas, the educational, where you can have these wonderful feelings, these wonderful behaviors develop with the nurture. But these fear-based, these raw emotions, that's what you're trying to get away from through avoiding the conflict, the anxiety, the trauma that has driven these feelings, these behaviors. All right, that's all I have for this session. Hope you like it, and I will try to develop additional resources along this line.